Today, I'm going to talk about art therapy and intimate relationships. I will divide it into four parts: the definition and type of intimate relationships, how art therapy can help improve communication, the role of art therapy in enhancing emotional connection, and finally, the case study and some specific examples. Intimate relationships is a deep emotional connection and interdependence between two people. Such relationships often involve emotional connection, trust, communication, and close physical contact. Intimate relationships are not limited to romantic and sexual relationships, but also include family relationships and also the close friends. There are many types of the intimate relationships. Two people, when they are emotionally and physically attracted to each other and are willing to invest time and energy in each other. Such relationships often involve dating, kissing, hugging, and other forms of intimacy. A marital relationship is when two people legally and socially become partners through a marital relationship. Marriage involves not only emotional and physical intimacy, but also economic, community, and family responsibilities. The relationship between parents and children, a relationship based on love, care, and responsibility. Intimacy in the parent child relationship is expressed as emotional support and guidance. Relationships between siblings often involve shared experience, support, and camaraderie. Some close friends relationships are also a deep friendship that develop between two people, usually involving trust, support, and emotional closeness. Close friends may share personal secrets, pro- provide emotional support, and participate in activities together. Normal friendship, though not as deep as close friends, but still involve friendship and care. Friendships are usually based on common interests or activities. Platonic relationships involve deep emotional connection and intimacy, but do not involve a sexual or romantic component. Platonic relationships can exist between friends, family, or other non-romantic partners. A peer relationship is a relationship between two people based primarily on emotional support and shared activities, with no sexual or romantic component involved. This kind of relationship is common between roommates, partners, or like minded people. Regardless of the type of intimate relationships, there are several common characteristics. In an intimate relationship, both parties often have a deep emotional connection that gives them an important place in each other's lives. The foundation of intimacy is trust. Trust allows both parties to openly share personal feelings and secrets without fears of betrayal or harm. Effective communication is the key to intimate relationships. Through open and honest communication, both parties are able to understand each other's needs and feelings and resolve conflicts and misunderstandings. Both partners in an intimate relationship usually support each other emotionally. psychologically, and ma- materially, especially in the face of challenges and difficulties. People in close relationships often engage in shared activities, whether it's entertainment, work, or family responsibilities that enhance their connection and dependence on each other. Art therapy is a therapeutic approach that promotes an individual's emotional, mental, and social well-being through creative artistic process. It uses the visual arts such as painting, sculpture, photography, and etc. as a tool of expression and communication. Art therapy works in a number of ways to improve communication. For example, art therapy provides a nonverbal means of expression that is particularly suitable for those who have difficulty with speech, such as children, autistic people, or those with speech disorders. Through painting, sculpture, and any other forms, they can express complex emotions and thoughts without being limited by the expression ability of languages. Some emotions may be difficult to describe in words, such as trauma, fear, or deep emotional experience. Artistic creation can be a safe channel for each person to express their feelings. Through artistic creation, individuals can better understand their own emotions and inner states. This process of self reflection helps increase self awareness and self understanding to communicate more effectively with others. Work of art can reflect the inner world of the creators, enabling them to show and explain their feelings and thoughts more clearly to others. In the course of art therapy, sharing artwork can promote others' understanding of the creator's emotions and experience, thereby enhancing empathy and emotional communication. Therapists and other participants were able to better understand the emotional states of the creator by interpreting the artwork. Collective artistic creation activities can provide a common creative space, promote interaction and communication among participants, and enhance groups cohesion and mutual understanding. Participants will not only express themselves through the artwork, but will also be led to verbalize their creative process and feelings. This helps them improve their verbal skills and learn to use words to describe their feelings and thoughts. Works of art often require a story or setting, and by describing and explaining their work, participants can improve their narrative skills and logical expression. Art therapy provides trauma patients with a safe way to express and process their experience, helping them gradually exter- externalize and understanding the trauma, thereby improving their communication with the therapist and others. Through artistic creation, participants can reduce anxiety and stress and thus be more relaxed to communicate and engage with others. Sometimes art therapy is especially suitable for children, who often express themselves through drawing, play, and other creative activities. Art therapy can help children better communicate their feelings and needs, especially those who have difficulty expressing themselves verbally. For older adults, especially those with Alzheimer's disease or other cognitive impairments, art therapy can help them maintain their ability to communicate, provides a way to express emotions and memories. Art therapy is a method of promoting emotional, mental, and social well-being through the creation and experience of art. Its use of visual arts as a tool of expression and communication, contributing to a deeper emotional connection between individuals and groups. They can provide a safe environment in which individuals can externalize and express their inner feelings and ideas, and also this nonverbal way can help them to reduce anxiety and pressure when expressing emotions. So that can making the individuals more willing to open up and share their inner world. The process of artistic creation often bypasses the defense mechanism of individuals, enabling them to face and express their inner emotions more honestly, thus promoting emotional disclosure and communication. In art therapy, individuals reflect on their emotions and experience through creation, which helps to improve self-awareness and self-understanding, and leading more honestly and in their interaction with others. Works of art are not only tools of self-expression, but also bridges of communication and empathy. By sharing and interpreting the artwork, therapists and other participants can gain a deeper understanding of the creator's emotions and inner world, leading to increased emotional connection and empathy. When collective artistic activities provides a platform for interaction and collaboration. In this time, this process enhances the interaction and emotional connection between each other. Sharing the work and receiving feedback from others is an important part. This sharing and communication process not only helps individuals gain understanding and support, but also promotes emotional connection and among the group members. For people who have experienced trauma, art therapy provides a safe way to express and process their traumatic experience. Through artistic creation, they are able to gradually externalize and understand the trauma, thereby repairing emotional connections with the help of therapists and other supporters. In family art therapy, family members express each other's emotions and ideas by participating together in the certain of art. This helps to enhance understanding and communication between family members and promotes harmony and stability in family relationships. In group art therapy, participants build a supportive and understanding social network through art creation and sharing. Such network not only provides emotional support, but also enhances an individual's sense of social connection and belonging. Now, let's talk about three different practical application cases. The first one is about the children and parents. A child expresses his feelings about his parents, diverse through drawing. Under the therapist's guidance, the child is able to share these paintings with the parents, which promotes the parents' understanding and care for the children's emotions. They can see a lot of feelings and inner world through the painting, so they can enhance an emotional connection of the family. And finally, the child felt the parents' understanding and support, and also they have more communication and relationship between family members improve. The second cases is about a couple. A couple expresses each other's feelings and expectations in their marriage through joint the body art therapy. Under the guidance of the art therapy, they work with each other to reveal and understand each other's emotions and needs. And finally, the emotional connection between the couples is strengthened and communication become more open and effective. The last one is a trauma survivor group. A group of trauma survivors share and express their traumatic experience through collective art creation. In this process, members support and understand each other and forming a deep emotional connection. Through the therapist, they know each other how they be being alive, and even they still have the horrible memory for that, but after the therapist, they can feel more supportive and each person feel the empathy. So finally, individuals' feelings of trauma are relieved and emotional connection is significantly enhanced. Thank you for watching. In the next chapter, I will continue to share more details about art therapy and sexual health.